We have two specialists leading you through this session. One is here, and I'd like to introduce Fred Bergmann. He has an own clinic in Viernheim. This is close to Heidelberg. And he is a very experienced dentist and oral surgeon working in implantology for years, doing the full range of implantology. And one of his newest playground is also guided surgery, so he's really a specialist in this area.
We are looking forward to the next highlight. And this highlight will be a live surgery. It will be a guided surgery. It will be a surgery minimal invasive. And it will be a surgery delivering immediate temporary restoration with a bridge work based on 9 implants in a edentulous atrophied maxilla. Dr. Michael Stiller is Associate Professor for Oral and Maxillofacial Surgery here at the famous Charité University in Berlin. And he works in an own private dental center in Berlin for oral surgery and implantology. The prosthetic restoration you will see at the end is done by Master Dental Technician Rainer Struck. Please, ladies and gentlemen, welcome Dr. Stiller for his home play here in Berlin. And I would like to come back for 2 minutes again to the PowerPoint because I want to give the audience the clinical case and I want to give them some screenshots about the planning. Here you see the preoperative situation. We have some remaining teeth 12, 22, 24 and 26. We see the temporary provisional overdenture the lady is just wearing at the present time. And we see the X-ray before extraction of this canine. So this is our situation clinically. We have the study model, which is the basis for the diagnostic setup. And on the right side, you see already the scan template, the scan denture, marked here for the radio density with some markers. And with this scan denture, we deliver now our 3D data. And this double scan protocol allows us a lot of advantages. And you see immediately when you look here on the screen, the cross section, you see the axial section, you see the longitudinal section, and you see here the 3D of the situation before. Then we are going to plan our implants in the correct position and angulation, and the 3D overview of the 9 XIF implants. And you see, we see already where do we have some bony defects and how we place the implants as well under surgical aspects, under bone aspects, and under prosthetic aspects. And here the axial overview of the internal hexagon, and you see here that we require a couple of angulated abutments to have an ideal situation for the temporary restoration. And here's the planning of the abutments. You find straight and angulated abutments, color-coded 3.8 and blue the 4.51. And also yesterday Mr. Struck delivered the temporary bridge work. Here this is a acrylic fabricated temporary bridge work which will be installed in the mouth of the patient directly after the last implant is placed. You see what Michael did? He planned here 2, 4, 6 mini screws, and this is it. This is the final surgical guide with the sleeve on drill system expertise for our live surgery now. And this is the overview of this bridge work, as you will see in a couple of minutes in the mouth of the patient. And here is the hardware. This is the drill system, the expertise drill system. It's very easy, you will see that. We just drill down, we have a vertical stop, and the position and angulation is before determined. Now we can go back to the live surgery.
Yes, okay.
Okay, now it's getting better.
Thank you very much for your kind introduction. Let me start. And we will start with inserting the drilling splint, the upper jaw. The patient got an IV sedation, slightly, and a local, of course.
Yeah, perfect. Now we can see here the surgical guide when you make the try-in with the stent.
Zumachen, vorsichtig. Locker, nein.
And you see what Michael did? He used this stand to find the correct prosthetic position of the tissue-supported guide here. Now the first drill for the fixation of the mini screw is to be done. Just local anesthesia. So now we can see how Michael already is going to fix the first mini screw. And we can see the tissue and tooth supported surgical guide in place, and the second screw is here just. It is very important that the surgical guide is fitting perfect and is perfectly accurate, adapted with these mini screws. Only then we will find the correct position for our implants. This is the reason Michael planned 6 of these mini screws. Highly professional. Here we see the palatinal side. Now I think this is the last of this mini screw to be fixed on the palatinal side, and then I think we are getting a perfect primary stability, because this will be an implant operation with a tissue punch, so a flapless surgery, a minimal invasive one. This is the tissue punch to remove the mucosa and the periosteum to get the access to the bone, because it's totally adramatic, a flapless surgery. This tissue punch, how many rounds per minute does it work?
We have approximately 800 per unit.
Yeah, you see we have 2 diameters. This is the 4.5, as Michael already mentioned, and the 3.8 for the front and premolar area. 3 of the 9 implants, the distal implants, are planned in a 4.5 diameter, 4.5 millimeter diameter, and we see the blue color here. And now we see the next drill here. Yeah, this is again the initial drill to mark the position, to mark the cortical bone, and to prepare the situation for the next twist drill, for the pilot drill. And you see the sleeve-on drill system. We just go vertically down until we reach here this vertical stop. This is very easy to do, because you have not take care how much I am now vertical down. Is it correct? You just go down until the stop reach here this final position. So for sure we have different vertical lengths of the implants.
Fred, I feel the bone is very, very soft.
Yeah. This we can imagine. We saw the pre-operative panorama, we saw the 3D.
Yeah.
And this is
She has a very soft bone.
for the different lengths, you get individual drills in the corresponding lengths. So it is very easy for your procedure.
Fred, the next step is a cortical drill. Because of soft bone, I will go to the first ring, not more. The bone is very soft. Yeah?
And here you see the 3.8 diameter XIF plus implant with 15 rounds per minute, and without cooling with the line is the placement procedure here. And here you see some of these dots.
Okay.
They give you some information about the position of the internal hex. The next thing we are going to do is we will give a fixation pin in the implant position here to give the surgical guide more stability. Here you see this fixation pin. This is to be done at least on 2 implants here, premolar on the right and on the left side. And this is another aspect to give a stability to the surgical guide and to be on a correct, precise way.
Fred, you feel the improvement of the stability if you insert the fixation pin.
What you saw in the drilling procedure is this, and here you see it again, this sleeve-on drill system. That means that on all corresponding drill you have a sleeve, and this sleeve gives you the information about your vertical position. You just go down until you reach the vertical depth stop here. The final drill.
On the yellow ring.
The final drill in case of a soft bone. Here you see the vertical depths.
This is
Michael just
impressive.
reached.
The drill is very sharp.
And now he has to decide soft bone or dense bone. He has to use the tab or not.
It's difficult to decide if it's soft bone because the drill is unbelievably sharp. It's very nice. You need only slightly pressure for preparation. Perfect. Really nice.
Is that really operation? We cannot see any blood, Michael. But
Yeah. No, there's nothing.
I think
No blood.
it's a really traumatic
It's a
procedure
pressure.
then. The patient is well,
Impressive
yeah?
procedure.
Patient is okay.
Flapless.
It's a nearly bloodless surgery, yeah?
Everything is perfect. It's a patient is very, very
You have
relaxed.
some monitoring and, yeah, I see the patient is moving. Everything is okay, yeah?
Yeah.
So the next implant is to be placed. You see the 3.8 size with the blood surface here. And also this is unique that you place your implant through the surgical guide. Only one guide for all drilling procedures and only one guide also for placement of the implant itself.
So
This is the second
stent is
fixation
very tight.
pin to give more stability to the surgical guide.
Yes, the stability is perfect. Absolute perfect.
So the reason Michael placed first one implant on the right side and then the second implant on the left side was to give here this fixation pin to increase the stability, or no, it's already stable, but to be safe with the stability. And I think now you are going on drill by drill for the next implants in the front. All these implants are supposed to be 3.8
It's a 15
diameter implants.
millimeter.
Here you see exactly how the sleeve fits, and here you see the vertical depth stop.
Yes.
It looks very nice, very atraumatic, but local anesthesia is really done, yeah. For the next twist drill here, you see the color and the code in the molar areas.
Okay. Sleeves are perfect. Yes, you can see the internal irrigation.
Ah, yeah, now we can see here the crestal drill 3.8. In case of the better, more dense bone quality, we use the crestal drill, maybe also the tab. This is the decision the surgeon will do depending on the bone quality here. In the maxilla cases, very often the tab is not necessary because of soft bone quality. And here you see the next 3.8 Xi Plus implant with a 10-base abutment, which is at the same time placement holder for the implant, temporary abutment, and is also good for index registration. This is a really good idea with this fixation pin to give a stability to the surgical guide. A mini screw and two fixation pin on the left side give enough stability for the surgical guide during the drilling process. This is not a new panel discussion, perio treatment versus extraction. Michael will extract these teeth after the placement of the last implant, so they are just here available to help us for stabilization of the guide. I think this is not a secret, this is a surgical guide which is based on bone or based on teeth is more easy to handle than a guide which is only based on soft tissue, on the mucosa, and therefore we are pretty happy to have these remaining teeth for a better fixation. Each dot gives you information about the horizontal part of the internal hexagon in the Xi implant. This is just important when you are going to place an angulated abutment later. Again, we can see Michael does this very slowly, very atraumatic, 15 rounds per minute, not to damage, to overheat or give too much pressure to the bone. Yeah,
Okay.
you can see here now exact position, the dot just on the opposite side of the mark on these sleeves. So what you see now, all 6 3.8 diameter implants are placed, and all these implants have the fixation pins. And now Michael is starting in the molar area with the 4.5 diameter implants. The white, yeah, is it a wide body implant? Okay, in the molar area, in that soft bone, maybe the bigger surface can also help us in that question of primary stability and in that question of immediate loading. Now you see the blue color, the first time Michael is using the 4.5 twist drill. Here in the molar area of the maxilla we have a D4 quality. You get also a feeling when you drill, and you get an idea on your CT evaluation. Yeah? You can see the quality of bone and you can feel it during the drilling process, what kind of bone quality you are going to expect.
Very weak bone, you saw it, yeah?
Yeah, we can imagine this area is not so easy to reach.
Oh.
And the implant again is, or the drilling is again in the correct position when the vertical depth stop of the sleeve here reach the position on the guide.
Very, very weak bone. We don't use the crystal.
Yeah.
Let me check.
Yeah, the next step is then to remove the surgical guide. Before we can do that,
Okay.
we have to remove the fixation pins.
Fixation pins I remove. Perfect.
So the first step is to remove the mini screw. We can see here a part of the mini screw here in the vestibulum before you reach the tissue and before you reach the bone. The same picture we saw on the screenshot for the 3D planning. These are the same type of mini screws you are going to use when you do a fixation of monocortical bone block transplants.
Yes,
The same
absolutely the same.
Yeah. Yeah. Now we can see a little
Okay.
bit bloody stuff here. We see the tempbase abutments
Only.
of the 9 implants. And the next step is now Michael will change these tempbase abutments. He will remove them and give aesthetic base abutments, which you saw on the screenshots we planned before. The reason he do so is that we are going to use some kind of angulated abutments. Yeah, thank you. And we come back to the patient.
Okay.
We just saw that Michael is going to close this internal channel for the screw with some temporary acrylic, I guess something like Fermit.
Now I try, I fit in.
Yeah, okay,
The
this is
temporary
the try-in
restoration.
of the temporary bridge work. So,
Okay, close.
okay, now he's going to
No,
check
die richtige
the position of the
Richtungsfilm
temporization with a splint to
No.
make the connection in the correct position for occlusion reasons.
Okay.
Here you see the patient won't
And-
open again. She is happy with her temporization.
Okay, I have to explain something. I don't insert the temporary, not the aesthetic base abutment in the region of 1/7, and be closed with a closer
Gingiva
screw.
former?
No, only closer screw, no gingiva former. Okay,
Yeah, very
the
nice.
patient bites.
So the next step is the Michael will deliver us a panoramic post-operative X-ray.
We interrupt now because we would like to make the panoramic X-ray.
That's really impressive. Very nice. Great. Michael, big hands for you.
Okay.
Great work.
Okay. Michael, Fred, thank you very much. I think this was an impressive last session. I was a little bit nervous whether everything works well, but it did. It did work perfectly. And, well, what can I say? Was a great final here in the last session. Thank you, Fred.
Thank you very much, Werner. Thank you.